Hello and welcome to Health Issues, the program that takes an in-depth look into health challenges faced by humans in our society. I am Anita Fatunji. Today we shall be taking a look at Ebola virus. Ebola virus disease is the human disease caused by Ebola viruses. Symptoms start 2 days to 3 weeks after contracting the virus with a fever, throat and muscle pain and headache, followed by nausea, vomiting and diarrhea, along with decreased functioning of the liver and kidney. At this point, some people begin to have problems with bleeding. Ebola first appeared in 1976 in two simultaneous outbreaks in Nzara, Sudan and in Yambuku, Democratic Republic of Congo. The latter was in the village situated near the Ebola River from which the disease takes its name. Let's take a short break. We will be right back with details.
Nigerians continue to
travel the city of Lagos.
There is still a poor level of
Be the first to know. From the north, south, east, west and around Africa, we break the news.
One Nigeria.
Welcome to Core TV.
24-hour news station.
Welcome back. Ebola is introduced into the human population through close contact with the blood secretion, organs or other bodily fluid of infected animals. In Africa, infection has been documented through the handling of infected chimpanzees, gorillas, footbats, monkeys, forest antelope and porcupines found ill or dead or in the rainforest. Ebola then spreads in the community through human-to-human transmissions, with infection resulting from direct contact through broken skin or mucous membranes with the blood, secretions, organs or other bodily fluids of infected people, and indirect contact with environments contaminated with such fluids. Burial ceremony in which mourners have direct contact with the body of the deceased person can also play a role in the transmission of Ebola. Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery from illness. We have a video of some cases of Ebola virus infection.
Ebola continues its frightening and rapid speed through West Africa. 3 countries, Guinea, Liberia, and Sierra Leone, are at the center of the outbreak. As of July 12, 2014, the cumulative number of cases attributed to Ebola in the 3 countries stands at 964, including 603 deaths. But those numbers are steadily rising, and health workers on the ground say it's out of control. Doctors Without Borders say the number of patients now being treated in Sierra Leone could just be the tip of the iceberg. What are the symptoms and how does it spread? The most extreme symptoms of a pre-fatal case of Ebola is bleeding from the ears, nose, and mouth. People generally become infected with Ebola through contact with infected animals, such as bats or undercooked bushmeat, and then spread the virus to others through direct contact with bodily fluids. Is there a cure? Unfortunately, there is no Ebola vaccine and no known cure. Ebola is a particularly challenging virus because of the difficulties preventing and containing an outbreak. So why is it so difficult to contain? The key to halting Ebola is isolating the sick, but fear and panic have sent some patients into hiding, complicating efforts to stop its spread. The chance of Ebola spreading out of West Africa is very, very low, says infectious disease specialist Cameron Kahn.
Ebola is one of the deadliest viruses known to man. It's named after a small river in the Democratic Republic of Congo where it first emerged in 1976. Up to 90% of infected individuals die from the virus. The African fruit bat is considered a natural carrier of the infection. Gorillas, chimps, monkeys, antelope and porcupines are also susceptible to catching and spreading the disease. There are several strains of Ebola: Zaire, Sudan, Bundibunjo, Reston and Thai forest. They're spread through contact with the blood, body fluids and tissues of an infected person. Researchers say airborne transmission may also be possible. After an incubation period of between 2 and 21 days, symptoms include severe fever, weakness, muscle pain, headaches, and a sore throat. This generally develops into vomiting, diarrhea, rash, impaired kidney and liver function, and sometimes internal and external bleeding to death. The Ebola virus multiplies quickly, overwhelming the immune system to fight the infection. No medicine or vaccine currently exists.
Welcome back. Other diseases that should be ruled out before a diagnosis can be made include malaria, typhoid, fever, shigellosis, cholera, leptospirosis, plague, rickettsiosis, relapsing fever, meningitis, hepatitis, and other viral hemorrhagic fevers. Ebola virus infection can be diagnosed definitely in a laboratory through several types of tests. No licensed vaccine is available. Several vaccines are being tested, but none are available for clinical use. Several ill patients require intensive support care. Patients are frequently dehydrated and require oral rehydration with solutions containing electrolytes or intravenous fluids. No specific treatment is available. New drug therapies are also being evaluated. For better understanding, we spoke with experts. Let's find out what they have to say.
The arrested virus has caused disease in humans, but it tends to be very mild. But everyone suspected that this virus, that when it was positive for Ebola, it was certainly the Ebola virus from Zaire. Typically, Ebola has an incubation period of 8 to 10 days. It can rarely be longer than that, up to 21 days. And that's why we follow contacts all the way out to 21 days. Usually patients present with acute onset fever, headaches, chills, weakness, body aches. They have gastrointestinal symptoms that are very common, vomiting, diarrhea, and abdominal pain, and that's what this patient was having. And about half of the patients have hemorrhagic symptoms, either nose bleeding, bruising, as well as hematuria was detected. With severe hemorrhagic manifestations, you get bloody stools and a DIC, multi-organ shock. Less commonly, you can see a rash on the trunk and shoulders, red eyes, sore throat, cough, and hiccups. Probably an indicator that there's an epizootic going on in the animal population. Next slide and next slide. The majority of outbreaks are due to Ebola virus or the Zaire. Ebola is generally considered to be a spillover event. And usually people get infected from exposure to animals in the wild. And so hunting and exposure to dead wildlife are the most common causes for index patients. And then these patients can expose other humans, and you get human-to-human transmission. And that's certainly what's driving the outbreak in West Africa at this time. The human-to-human transmission is almost always associated with direct contact with the sick patient or their body fluids. And of course, in the nosocomial setting, particularly in resource-poor clinics and hospitals, with limited PPE, this can be a major problem and a major driver of an outbreak. Caregivers in the home are often at very high risk, as well as people that are involved in burial practices, people that handle the body. This slide shows the number of cases by year, first detected in Congo in 1976. It had 318 cases and 280 deaths. Generally, the mortality ranges from 50 to 90%. And you can see those different outbreaks had variations in the size. Next one. Find and follow contacts for 21 days. If a contact becomes febrile, they need to be sent to a treatment center and tested, and they need to be isolated if they're testing positive. They need to have a huge health education in the community with risk reduction messages to the community and health centers, particularly focusing on avoiding close contact with sick patients, patients getting reported that have suspect of viral hemorrhagic fever, avoiding bushmeat, and avoiding contacts with bats.
virus with 4 strains, out of which 3 are considered human infection, human and animal infection. So the first 3 are causing infection, causing these problems. And the one that's now arriving in Nigeria is Ebola Zaire substrain. This is a picture of the virus. It looks like a rope that hangs people. You can see that it has a knot. This is a very deadly disease, killing people. With all our modern technique, modern science, we have not been able to pinpoint which animal is the exact reservoir of this virus in the nature. So if you see on the left side, you see birds, insects, plants, and primates. And yet, none of these can be pinpointed to say this is the reservoir. It makes it really more deadly. Very funny incubation period, and at the same time, a disease that you get the virus today, by tomorrow or day after, you already it's possible it causes disease in you. So it's a very potent virus. It can cause disease very quick. It can also die low in HP, and maybe incubation period can reach 10 days, 21 days. But the mortality rate, please pay attention. Between 50 to 90%. The first outbreak was 91%. 91% of those infected all died. It's not acceptable. And what does it do? It kills, it attacks the hepatocyte and the endothelial cells. And we know what that means. So it can lead to multiple organ failure within a short period of time. Okay, so issues on region. All this, didn't show Nigeria map. Nigeria is very white. Unfortunately, no longer. Why is it perpetuating in West Africa? They have been shown that this is the first time again the Ebola outbreak has actually 3 modes of transmission going on at the same time. The rural outbreak, which is occurring within the rural areas, then the urban outbreak, which is now like jumping from the rural to urban, and then the cross-border outbreak, which is now occurring particularly in unofficial borders. Like what do you call this border around Badagry? Seven exhibition. Why in 7 you have border where people can cross? There are several challenges. These challenges are what you can talk about from now till maybe the end of the century. But the key, we have to know them and know how to address them. This disease is occurring in countries that are weak, with weak health systems. Several communication, technical, or any challenge that you want to have was seen in this virus. Our fear, before I go, is that please note, if this virus is multiplying in humans, it means that the virus is adapting to human cells, and it can become more and more endemic and really become a terrible killer, which we don't want to happen. That's why the world is raising against the virus. For Guinea, we have the highest, 75.6% fatality rate. People die there more. Next, for Liberia, about 60% fatality rate, and then for Sierra Leone, also 60%. So none is lower than 50%. It's a killer. He has talked to you about the ministerial, because the ministers of health of affected countries and the concerned partners came together in Ghana to address outreach countries. What did they find? They found out that coordination was so poor, everybody was doing so, and our efforts were not effective. Next slide. They identified issues and lessons learned. Next slide. And one of the few things that they found is that we were ignoring the role of communities who actually own the patients and also own the dead bodies. They bring the patients. When the patients die, we give them back to the patient. So you are treating the patient and you are not taking into consideration their characteristics. their religion, their tradition, so on. What happened? Cases started coming. The existing health system couldn't manage it. MSF and other education organizations came, established 21st century treatment centers, isolation centers. And the communities were pushing their patients there. So they will bring 100 patients, and within 1 week, they will bring out for them 60 beds in bags. But I'm happy to announce that at least this case has shown that both federal and state government are on top. We are here to work with you to make sure that we can handle this. No vaccine. The virus is so terrible. So far, no vaccine. Even though some efforts are being done now to see maybe there will be one by National Institute of Allergy and Infectious Diseases. What do you need to do? With all this information here, because it's our duty to tell you what we are doing. But now, it's not just occurring in those countries only, it's already appearing in Nigeria. And what Nigerians are waiting to hear from us, is this the only case that is in Nigeria now? Has any Nigerian acquired any infection? Has the virus escaped?
At this point, we should talk about how we can work together to properly submit all of that. Because, the private sector here is vital. So what I think we need to get from the experts now are SOPs, steps to take when we see suspected cases, what to do, who to call. That's what I think we need at this time. That way we protect the community so that we further ensure that the virus is completely controlled. So that's where I think we are now. I think we need further information from the experts and the government on what our role is vis-a-vis further ensuring that the government is the virus is contained. And then, because it's collaboration at this point.
From the presentation of this particular virus, I could see that one of the problems is that drugs cannot survive temperatures more than 60 degrees. And if you consider the global environment where a lot of the people depend on bushmeat for their projects of life, they do subject this meat to very high temperatures before they consume. How come this virus has been able to come out of the villages and now moving to the urban centers?
Now, in those other West African countries we have mentioned, we talk of treatment centers. What we have said here, we have not mentioned anything like that here. We are saying when we get these cases, we should not refer. It's like we are giving them no hope at all. But the case mortality is not 100%. Why don't we create maybe 4 centers? We have a suspect case, we call the government, they have a special means of transportation, move these patients there, treat them. The experts should give whatever they can give. And those that are lucky will survive. Those that are not lucky, they take over from them. What we have now is like a hopeless situation. Once you get it, don't bring it to us, keep it in your place. At the end of the day, the patient goes. We don't have a plan.
Very far from here, in some rural areas, some other states. The question is, if we see a suspicious case, how is the mode of extraction of the blood sample? What sample do we conserve that blood? How long can that sample last and remain viable to be transported to a place like Lagos for proper tests?
To provide answer. Surveillance. Report any suspicious case. As the SA said, don't treat the patient, don't transmit the patient alone. Call us and we shall be there to see how we can help you handle the case. We pray that this will be the last case we are seeing. Thank you.
Automatically is gotten immunity. And that one will protect him or her against subsequent attacks. I think it's been reported that they've used plasma from survivors to treat some cases. And you can see from the dose recovery, it shows that their immunity struggle to fight back. So once the viral load is down, then the immunity will pick up.
The mode of transmission is through contact with body fluids, tissues, organs. Okay? When we say body fluids, blood and other body fluids, urine, feces, sweat, saliva, and so on. Okay? And semen. So, if you look at that, then you begin to think about what puts an individual at risk. To what extent do you come in contact with the body fluids? If somebody sleeps with somebody who is known to be infected with the disease, that is very high risk because the beddings will probably contain sweat, will probably contain saliva, will probably, you know what we mean. So,
in the area where they have 3 ways of handling bushmeat. One processed raw and eaten them. You eat the soup and whatever, kill and process immediately. One that they use like freeze drying, sun drying, and then the one that they smoke. So it is the smoked bush meat that contains the Ebola virus. So you are right. The one that you cook well, the one that is processed well, you don't get the Ebola virus with the virus is there. But smoking doesn't kill the virus. So please remember, smoking, bush meat, and so which bush meat? It's not called bush meat. No, suya no. Suya happens to do with Ebola.
We've had instances of vegetables that are contaminated by these animals, especially fruit, the fruit bats, through its feces and saliva, and even fruits eaten by these bats. And other sources of contaminant for those primates. When they now eat such infected fruit, they come down and die. So we should be wary of that. That's the fruits. Advise them to wash the fruit very well with vinegar or salt.
Thank you for staying with us. In the absence of effective treatment and a human vaccine, awareness of the risk factor for Ebola infection and the protective measures individuals can take is the best way to reduce human infection and death. In Africa, educational public health messages for risk reduction should focus on several factors. Number 1, reduce the risk of wildlife to human transmission from contact with infected food bats or monkey or apes and the consumption of their raw meat. Animals should be handled with gloves and other appropriate protective clothing. Animal products, blood and meat should be thoroughly cooked before consumption. 2, reducing the risk of human-to-human transmission in the community arising from direct or close contact with infected patients, particularly with their body fluids. Close physical contact with Ebola patients should be avoided. Gloves and appropriate personal protective equipment should be worn when taking care of ill patients at home. Regular hand washing is required after visiting patients in hospital as well as after taking care of patients at home. 3. Communities affected by Ebola should inform the population about the nature of the disease and about outbreak containment measures, including burial of the dead. People who have died from Ebola should be promptly and safely buried. This is how far we can go on today's edition of Health Issues. Join us next week for another talk on health. Have a wonderful day.